Week 5 Feedback, Chapter 7 and 8 Questions and Video. Chapter 7 Accident Investigation and Anticipatory Failure Analysis. Question 1. Describe the difference between root cause analysis and anticipatory failure analysis. Quite simply, root cause analysis is a structured approach for identifying and outlining the events sequence leading to an accident. It is a process of working backwards in time, recording each pertinent event retrospectively. Anticipatory failure analysis. This is an 8-step process of identifying latent failures and resolving these problems, hence making riskier patient care processes safer. It's a prospective process. This is a fundamental structure that your patient safety initiative project should be based on, identifying and devising a way to make it safer. Question 2. Search the literature related to root cause analysis and anticipatory failure analysis activities in healthcare organizations to identify how project teams are commonly formed and what departments are represented on these teams. Well, quite simply, you have to look at the literature, look at various root cause analysis or anticipatory failure analysis. But what I was looking for in this question is that that root cause and anticipatory failure project teams are formed usually by leaders or administrators. They put together a team of experts or people with high skill sets and abilities. Sometimes they work in that setting, sometimes they do not work in the settings. What's important with this interprofessional departments are represented. Every member can be represented. Sometimes the people are familiar with the setting, the various processes of the project. Oftentimes managers, administrators, as well as every department, for example, department heads in medicine, as well as nurses and pharmacist departments are there, as well as frontline expert workers should be involved in the process. So this is a process that interprofessionally all departments are made available. Question 3. What organization strategies might be used to create and sustain attitudes and behaviors that support root cause analysis and anticipatory failure analysis activities in healthcare settings? Healthcare organizations must adopt a culture of safety and reliability that places value on procedures, policies, and reward systems that promote error and tolerance. There's no shame, blame in these organizations. There's a proactive risk assessment technique. In other words, looking at problems and anticipating areas that need to be fixed. Chapter 8. MTO and DEB analysis can find system breakdowns. Question 1. What are the similarities and differences between the MTO analysis and the root cause analysis process described in Chapter 7? Quite frankly, this is basically, I was looking at the similarities and differences. And there are many similarities and many differences. MTO stands for Man Technique Organizations. This identifies the underlying cause of accidents derived from the system theory. The similarities, they both have the same goal in line, meaning they look at things retrospectively. MTO involves mapping, gathering information retrospectively, and both do that. Both analyze accidents once they have occurred. Both of these types of retrospective theories must have a high integrity investigations, and both give reports. The differences: the root cause analysis begins with outline or timing event. The Joint Commission requires root cause analysis. MTO guidelines for establishing, they usually are formed with teams. MTO reviewing information and interviews to gather, and they do a map or diagram. There are a high number of latent errors discovered in MTO. Root cause analysis works backwards and develops a timeline of events. It's a recommendation for a root cause analysis versus MTO, which causes usually practice change. Question 2. What are the similarities and differences between DEB analysis and anticipatory failure analysis described in Chapter 7? DEB analysis, the deviation effect barrier, is designed specifically for use in a complex social technical system such as healthcare. DEB analysis is used for examining a healthcare system for design flaws before an incident happens. Similarities: both access latent flaws in systems between accident occurs. It's a proactive process. Both use proactive risk models. The difference: the Joint Commission requires accredited facilities to conduct proactive risk assessments. However, they don't describe which system to utilize. The DEB design is designed for social technical systems like healthcare. Question 3. Describe the advantage and disadvantage of MTO and DEB analysis as compared to accident investigation techniques described in Chapter 7. They utilize the team approach to mapping and analyze accidents in DEB analysis, specifically designed for healthcare proactively. This process may be financial and time-consuming for the organization. However, this active process will uncover many errors. And so the advantage is that both processes discover latent errors. However, the financial impact and the sustainability will be difficult with the DEB process. The video, the Novice Dennis and the Carol Burnett comedy, although very interesting and funny, it served a unique purpose. The purpose is that it allows you to analyze retrospectively and prospectively at a video. Although when the video was made, universal precautions were not enforced, it is obvious when applying today's standards that Dennis made a lot of errors. Many of you correctly identified communication as well as multiple errors that Dennis made, from professional to breaking and sterility, all in total close to about 13. As healthcare providers, we must close the loop on communication. That Dennis could have communicated that he was not safe and his knowledge or skills to do the task. He should have been upfront and honest. He should have never attempted without supervision. Effective communication from the nurse to inform the patient that the doctor was not safe or was new was very important. It could have been stopped right then. In healthcare, we do not operate in isolation, and we need one another to work together as teams. The dentist should have immediately informed the patient that he was not comfortable and assist the patient in getting the needed dental help from someone competent. Thank you.